Um, and so we are recording this session as well for anyone that is not able to attend with us in real time. But my name is Caitlin Green, and I oversee career services for graduate students in the School of Public Health. And we're really delighted to be here today with one of our fantastic alums who's going to share more about his current work. And so I do want to just make a quick plug. We have scheduled a session that's very timely to reflect what we know are incredibly challenging circumstances facing all of society and certainly our local communities here, as well as the public health field and the economy. And so we will be holding a session from 12 to 1 p.m. this Friday, April 10th, on managing your job search in the time of COVID-19. And we look forward to engaging with anyone who is starting or in the process of job searching to touch base with us for some resources, support, and ongoing idea generation and community building in this space. So we are here to support you in career services. I want to turn it over to Ruth Ann, who is a fearless and significant member of our career services team, who will serve as moderator and interviewer for today's session. So thank you everyone for being here. And please don't forget to share any questions in the chat box. I'll be monitoring those throughout.
Uh-oh. We're back on again. Right. So yes, thanks to everyone for joining us. As you join, be sure that you put your, introduce yourself using the chat box. And if you have any questions that you want Chris to address, be sure to put them in there. I want to thank everyone for being here today. You know, there's a lot of uncertainty, and it seems like every day I have something that I plan to do and I hear something in the news that prevents me from doing it. Like it started when I was going to go skiing, and then suddenly we got the shelter in place, and then I was going to go shopping, and then it was even, now we're sheltered in place for another month, and I went to go shopping and the lines were ridiculous. So of course I didn't wait in any of those lines. I know public health. I went home. So yeah, every day there's lots of uncertainty. Everything is changing. So we're really grateful that you're here, and we're going to get through this together. With all this uncertainty, the one thing that I know is that there's a lot of need in public health. And so I think that there will continue to be jobs and there will be opportunities in the public health domain as a result of this, this health crisis that the nation and the world is facing. So with that, I want to introduce Chris Chau. He's an alum of our DrPH program. He works at the San Francisco Department of Public Health, and prior to attending Cal, he received his MPH from UCLA. He's a registered dietitian. In addition to his work with the county at SF, he also works currently at Kaiser Permanente. And in the past, he's worked at UCLA and Teach for America. I know we have a lot of alum that have come through the Teach for America pipeline. So Chris is committed to improving nutrition and physical activity across diverse communities. And I'm gonna turn it over to Chris and let him further his introduction and tell us a little bit about himself.
Sure. So good evening, everyone. My name is Chris Chau, as Ruth Ann said, and I'm a Cal alum. I graduated from the DrPH program about a year and a half ago, somewhere around there. And it's been an interesting adventure navigating the process of trying to get through grad school and then applying for jobs and then trying to see that there's a light at the end of the tunnel and that you will get hired and you will get a salary again after you've been a student. So yeah, and I can walk you through all of that. Yeah, I mean, I can start off with, you know, a little bit about like my kind of my journey into public health, a little bit, if that will help people. So as Ruth Ann said, straight from undergrad, I was all about teaching. Public health wasn't on my radar. I was not thinking about public health, nutrition, or any of that. I had majored in bio and then did a minor in ed and then applied for Teach for America. And then 2 weeks after graduation, moved to New York and then started teaching. It wasn't until a few years later where I started to see the impact of obesity and the eating habits of my students in their classroom that I started to realize, like, okay, we need to start addressing issues as a community and as a population. And so long story short is I decided, okay, well, I should do something about it. So I taught the first nutrition education course that was there. It became it became really successful and popular among students, and then parents got involved. And so long story short was I thought, well, if this can happen within this small little microcosm of my classroom, what could I do larger than that? And in order for me to do that, I should probably get and strengthen my foundation in nutrition and public health. So that's when I went back to school. And I did my, I moved back to LA, and then that's when I applied for my, my master's of public health. And then I also applied to get to do my DPD, which is the nutrition coursework that you need to do if you didn't major in it, and then eventually get my RD through my clinical rotations at the VA West Los Angeles. And then from there, I did a little bit of work in public health, which you can talk about a little bit more. But I worked for UCLA. So I did my NPH at UCLA, which was a combined program to do the RD as well. Sorry, I just got a message. And then from there, graduated and then was offered a job through one of my advisor's colleagues. And so I worked for UCLA for their UCLA REACH program. And again, we can get more into that, but it was a $20 million grant that UCLA had received to do like obesity prevention work nationwide, focusing on African American and Latino communities across the US. So did that first year, and then transferred and then worked for Cedars-Sinai in LA, working at the front lines of nutrition education, obesity prevention, physical activity. And then that's when I got inspired to want to go back one more time to grad school, and then did my DrPH with a specialty in public health nutrition at Cal. And that's it. And that's kind of the synopsis. And then I'll take more questions as we go.
So could you tell us a little bit more about your current position and working for SFDPH?
Yeah, so right now, and we can talk about the timeline afterwards as well if you guys are really curious about it. But so right after I graduated, I applied and was hired as a public health nutritionist for San Francisco Department of Public Health. And it is great. I could honestly say that SFDPH is, for a local government agency, it actually does a lot of cutting edge work that you wouldn't expect from a government. And I've had to partner with other governments in the past, like local government agencies, and federal. And so it's been interesting to be able to see how progressive they're willing to be with their approach. Currently, right now, we have changed our work plan, so we don't do a lot of direct service and education anymore, which is what they used to do in the last work plan, which ended last fiscal year. Currently, what we're doing is it's policy systems and environmental change. So, and this is handed down by CDPH, which is the California Department of Public Health. So they kind of set the goals. And then we as local implementing agencies then kind of take from the menu of those goals what we can do within our respective communities, and then we implement that for the next 3 years. And we cycle through 3-year work plans. And so right now we're doing a lot of exciting policy systems and environmental change. One of them is we're working with the Healthy Retail SF partnership / agency, where we are going in and working with local corner stores in the Tenderloin. And this is one of the side projects that I'm actually on right now. And what we're doing is we're pretty much building a database of all of their beverages that they're selling in their corner stores. And then my team and I are now categorizing those beverages on whether or not, if they're sugar-sweet beverages, if they are 100% juice, if they are deemed water, or if they're considered healthier beverages. And so we go through this process of like coding it and then categorizing and identifying it, and we submit that back to the corner stores. And so every single time that a community member or a resident goes and purchases that drink, we can see how much, what kind of drink that they are purchasing on a population level. and whether or not if any type of interventions, marketing, social marketing is actually having an impact on those respective communities. It's really great to be able to see how we can use data and technology right now with trying to reduce like sugar consumption and healthier beverage consumption, or increase healthier beverage consumption. So, you know, those are one of the projects that we're working on. Another one is where right now we just partnered with the Recreation and Parks Department, and this is a department that is a citywide department. So if you think about it, like we're working with another city agency that covers all of SF. And what we're doing is, because they are solely focused on physical activity, which makes sense, it's parks and rec, they really didn't, there was a kind of growing gap on what was their nutrition and or wellness policy. So for this new work plan, what we've done is we've partnered with Rec and Parks. And the other part of my project is we are now like literally developing nutrition and wellness policies from other sources, and then we're working with them to like develop it, to do focus groups, to do a needs assessment, to implement it, and then to evaluate it. So that's going to be the next 3 years of our project. So anyway, so that's kind of a glimpse of what we're doing right now. It's really exciting stuff. Where, you know, I've been wanting to get back into like community work and practice. So it's been nice to be able to be given this opportunity with SFDPH. Even though there are some drawbacks, so don't, like, you know, it's like, it's not all rosy, but that's a glimpse of it.
Chris, I love to see you getting so excited about policy and data analysis.
I'm such a nerd.
Uh-oh.
Sorry, you guys lost
No
it.
worries.
Sorry about that. That was how much I was so excited about data. With my phone.
I'm curious about, how big is your department?
Oh, wow. That's a great question. If we're talking about DPH, so I'm hired. So as you know, when you work for local government agencies, right, there's lots of bureaucracies and lots of divisions and all this stuff. So
Lots of silos, I've heard.
Lots of silos, and then lots of just like nesting, if that makes sense, like in terms of the way that things are kind of housed in different buckets. So for us, for me, I am hired through the Department of Public Health in the division of maternal, child and adolescent health. And then from there, we are split into, there's the WIC section, there's Nutrition Services, so that's the unit. And then from there, it is WIC, and then it is NEOP, which is the Nutrition Education Obesity Prevention branch, and that's us. So there's a mouthful.
And that's why you need an org chart to understand local government.
Exactly. So, so in terms of the number of people,
just in your unit, let's say.
In NEOP, this is how crazy it is. So in NEOP, we used to have a staff of 4, just 4 people, and 2 of them have moved on for promotion. So now we're down to 2, and we are looking to hire a 3rd, but it's just HR and hiring, all this stuff takes a while. So we're a small but mighty team at NEOP. And then WIC is at, I would say, probably around 40 or 50, don't quote me. And then in terms of DPH, I would say it's definitely in the thousands, around there. Yeah.
Okay, thank you. I know it's a tough question. I didn't ask it in advance for you.
Yeah, that's okay. And I was like trying to do the math. I was like crunching the numbers. I'm like, yeah, it's up in the thousands.
So could you talk to us about how you got your job with the county?
Yeah. Oh, what an interesting story. Yeah. So what I found out was that, so my department, my unit had posted the job multiple times, trying to find the right fit. So I didn't realize that the job posting that I had seen, hello, is everybody there? It like froze.
I think Ruth Ann may have frozen, Chris, but I think we can all hear you. Keep on going.
Okay, good. I wasn't sure. I was like, oh no, my Wi-Fi is going out again. Okay. So Yeah, so I was saying my unit had posted the job multiple times trying to find, trying to cast the net as wide as they could. I didn't realize that the job post that I had seen was the last phase of their post, but so I had found out about it through a friend. It was the most random thing. This is why it's really good to make friends while you're in graduate school, and for them to know what your content area expertise is, because a bunch of the people who sent me the link weren't in nutrition and weren't looking for government jobs, but they knew I was. So so I got forwarded a couple of emails that were for the same job, and and it was posted on Indeed. And we can talk about how they do the other postings as well later on if you guys are curious about it. But I had found out about it through Indeed, and I applied for it, and it was an extremely lengthy process. And I'm going to tell you this now, like I'm going to try and be as concise and and as efficient as I can with like all the tips I'm giving you. But my number one tip for you is to start early. I actually just mapped out how long it took for me to get from the minute that I submitted my application until I got hired, and that was 7 months. And that was expedited. So, so what happened was I applied for the position. I applied in mid-August, and I got called back for. I'm gonna look at it right now. I got called back for an exam in late September. And just to fill you in, an exam is where, so how it works for county is you apply for the job, and then if you make it through the first round, then you get called in for an exam. And that means you have to go in and physically take an exam. And that was 3 hours. And we can talk about, all of that stuff after, but it's a 3-hour exam. You sit in, you take the test, you get scored, and then you are ranked against everybody else who took the exam. So I found out later that there were 40 people who had applied for that one position that I was, and so they had ranked us according to that position, according to that, according to how you scored. So I got called into the exam in late September, and then I interviewed in early January, and then I was offered in early February, and then I had a start date in late March. So again, in total, that was 7 months. And if you take a look at the timing between when I was offered the position and when I started, it was a 2 months. And that, from what I was told by my supervisor, is fast. That was expedited because they were so understaffed at the time. So I just want you to know that was 7 months. And I would say give yourself probably 10 to 12 months. I hope that helped.
I'm back. Sorry about that.
That's okay.
Could you talk to us about if COVID-19 has impacted your work and how?
Yeah, surprisingly, so yeah, I can talk about that. So when you're a city employee, you are also, most city employees are also, will also be considered disaster service workers, DSWs. So when you get hired, you're told that whenever there is a disaster, a public disaster or any type of public emergency, there is a chance that you will be activated. And so when the mayor had released the order, she had also activated the city employees. And so what that means is you can get called in at any time and get pulled from your normal job responsibilities to work solely on, solely or a percentage of your FTE on whatever that emergency disaster is. So you can get called in to do COVID-19 work. Luckily, well, not luckily, I mean, I'm happy to do the work either way. So far, I would say my program has not been called in to do COVID-19 work, but many employees from DPH have already been activated and pulled to do work for COVID-19. So, and a lot of those vary. So if you're working at Zuckerberg, for instance, clearly you probably be working on the front lines, and so you'd be interacting face to face with patients who are coming in. For people who are working on the other side of on the other side, you would be doing more like data analysis, kind of managing who's who's been infected, are they considered a case, what are the number of cases, kind of doing the data crunching numbers. So it just depends. But at the moment right now, our program has not been called in to do that.
Thank you.
Yeah, sure.
What are the rewards and challenges of working for a county?
Yeah, I would say definitely let's start with the rewards. The rewards are, one, if you are looking to get into government space and do a lot of work with communities, building partnerships, working on projects together, doing collaborations, not only with community organizations, but other city agencies, external agencies, the private sector. You can do a lot of that, especially where in the program that I'm in. We partnered, just recently, we partnered with a city agency, community organizations, the San Francisco Giants, so private sector, and then we're also collaborating with a nonprofit app development company. So we're actually trying to do both, like technology, like the intersection of technology plus health plus public health, and yeah, and all of that together. So that was more than I ever thought that I'd be getting out of a government agency, to be honest. I didn't know that we could do all of these different partnerships and collaborations. So that's one of the main benefits. I think being able to work in the city, if that's a part of your vibe, is also a great benefit. Especially if you want to work with low income communities within San Francisco, that's the majority of the people that we work with, or the majority of the populations that we work with. So that is also a benefit. I would say there's also logistical benefits and practical benefits. Like when you work for a city agency, you also get really good benefits. I mean, I don't think that that's it's not something that you haven't heard of. Like, this is public knowledge that a lot of public employees have a pretty decent, I would say pretty good benefits, like medical and dental, etc. So there's definitely been an array of things that I've enjoyed working there. However, there are some drawbacks for sure. I think one of the drawbacks is when you're working in government, and I think everybody knows this is not new news for anybody, right? There's a lot of bureaucracy. Oh, there's so much bureaucracy. There's a lot. So you have to come in here knowing what you want to do, the population you want to work with, what kind of work and partnerships you want to build, and keep that kind of in the forefront and even the back of your head while you're going through these things, especially when you start hitting a wall with bureaucracy. Trying to get like external vendors paid, or trying to partner with this other company, and then trying to get money out to them, but there's like 16 steps before you can get them paid, and is that worth it for the agency, right? So there's a lot. There's a lot of red tape. So that's one. I think the second thing is when you're working with huge institutions, whether if it's like California State Department of Public Health or other agencies, you're also working with a lot of different personalities. And I think that is also something that, and the way that people are either conditioned to work, or the culture that they're in forces them to work, that there could be a bit of some like clashes there. So I would, and that's like typical for other jobs as well, but I would say just keep that in mind as well, that there are definitely drawbacks to working at a government agency.
What I like to say about the government agencies and the bureaucracy is, if you can't manage the application process, if that's so frustrating for you, then you might not want to work in that kind of environment, because I think the application process is a great starter for bureaucracy.
Yes, it's so true. Yeah, if you can't even handle the application, it may not be a good fit. Like, it's just, yeah, because the application was a bit intense, just the entire process, not even just the actual paper application that you fill out. I'm talking about like the 7 months of going through this process. So, yeah.
So next question I have for you, and we've got 2 more
Sure.
questions. We're going to turn it over to the audience questions.
Yeah,
So
I'm
be sure
excited.
to put your questions in the chat.
Okay.
Let's see. Oh, what coursework or classes do you recommend for students?
I really like this question. I would, for sure, you guys may or may not be shocked by this, but for sure, I would say definitely pay attention to that program planning and evaluation class. It's required from, I would say, all MPH programs. I have to go back and like consult that class from when I took it years ago. And then I also asked, I actually cashed in a really big favor and asked if I could actually audit the online MPH course that was on program planning and evaluation, because I'm doing so much of that. And that wasn't something that I had focused a lot on during the DrPH program when I was in it. You know, I did work in that in the past, and I did take a class in that in the past, but it wasn't something that was just at the forefront of my mind. I took a lot more stats classes, epi classes, and then the nutrition content classes. But looking back, I would definitely, that is one class where I went, should have enrolled in that, because I had thought about it too. During my first year, I was like, should I take that program planning? I already took it. Yeah, I don't, it's fine. And then look back, I'm like, you should have taken it. You should have taken it. So that's one. I would say the rest of it, it would probably depend on what your specialty is, for sure. I would, you know, what I did is I built, the DrPH is pretty flexible, so I built a lot of my classes based on the core classes, and then whatever the electives were, I filled those in with classes that I really liked, or that I knew that I had a gap in that skill set. So, you know, I took like nutrition policy, and I took a bunch of other nutrition classes and nutrition epidemiology, just because I wanted to make sure that I still kept up my nutrition skills, but then also that they were somewhat practical and applied. I would say like, you don't need, it's not like you're using stats every day, but I would say definitely I'm sure everybody's required to take a stats class, but stats, as much as you may hate it or cringe at stats, because like, why are we learning about t-tests? I don't understand. Like, what's going on here? Like all these, you know, nominal, ordinal, all these things, right? You know, when you're out in the field, like, you will get a refresher in it, but it is nice to be able to have at least the basic functions down. So being able to do like a descriptive analysis, where you can do like your averages, you can create graphs and things like that. I think that would be super helpful. So making sure that you, you know, I know all of you have to take the class, but make sure you're paying attention during the class so that you at least can pull out those kind of nuggets from the class.
No one has
yeah.
to be an expert except for the biostatisticians.
Right? Yeah. And
have the basic knowledge that if you pay attention in class.
yes, exactly. And remember, like, I took like 5 stats classes when I was at Berkeley, and I'm still a little bit, you know, every once in a while I still get a little bit unsure that I'm like, okay, am I doing this right? But like Lucian said, we have biostatisticians and epidemiologists at DrPH. If you need to check your math, you need to check your work, you can always go to them. There's, you know, you just set up a quick appointment, befriend them, you know, buy them a cup of coffee, and then yeah, and then just like, you know, talk shop.
Okay, last question for me is,
Sure.
what are the tips you'd give students who are seeking employment with SFDPH?
Yeah, I kind of spoke about this a bit earlier, but I want to make sure I emphasize this. Start early, for one, start early. The second thing is and I actually have, so Ruth Ann, so to answer your question, so Ruth Ann, I found the sheet. I was talking to Ruth Ann about this, and I'm going to forward this to Ruth Ann, but it is literally, one of the headings is how to find out about job openings at SFDPH. So this is a sheet that one of my colleagues who used to work at SFDPH had created for people who were just graduating. So if you just, you just earned your MPH, your DrPH, or even your bachelor's in public health. It's a helpful sheet, and it's really, really helpful. It's like golden. So what I would do is, so back to your question. So I would say, like, go to the SFDPH job listing website. And I would say you would need to search for certain positions, and I actually have them on this sheet. The tricky part with SFDPH is, with most government agencies, is that if you graduate with an MPH, you can't go onto the site and just type in like MPH and then see what jobs come up. That would make sense, but that's not how government runs, right? So you're like, oh, well, what do I do? What you have to do is you have to find out what are the classifications, which in DPH language is job titles. Those are called classifications. So you have to find out, like, what are the classifications that you're eligible for with your MPH. And so on this list, they have the different classifications there. You can also look up the your job number, and that is like another way to search for it. So it's either classification or the number. They're linked to each other, so if you looked up one, you'd get the other. But some of them, for instance, is like, if there was a posting for like a health educator position, I think a lot of people would kind of look at it and kind of roll their eyes and be like, oh my God, I don't want to be another health educator, right? But what you don't realize is that at DPH, the health educator classification is one of the most broad classifications at DPH. So what that means is you could be doing a bunch of different things in different areas, different content areas, but they don't have a way of classifying the job until they put it into health educator. So you could be doing like STI work, you could be doing like nutrition policy work, you could be doing SSB work, like working with the SSB advisory committee, or working with like city councilmen, or who knows, right? But all of that will be listed as a health educator, even though for the most part you may not even be doing education. But that's because that classification is so flexible that you can put other jobs underneath there. So that's kind of the tips and tricks that I didn't know when I was applying for DPH jobs. No one told me this, but now that I'm in it, I realized, oh my gosh, like, as I'm talking to people, I'm like, wait a minute, you're a health educator? And they're like, yeah. They're like, I'm doing policy work. I'm like, you're a health educator? I'm like, yeah, I'm doing like work down there. It's just like, I'm in the clinic. I'm like, oh my gosh. So, being fluent with what their classification terms are. So one of them is like a health educator, another one's like a health program coordinator, health program planner. So I will give you this. So don't think I'm holding back. I will give you this list, and to Ruth Ann, and she will post it so all of you have it. But so that's one of my tips, is being looking at the SFDPH job website. I would say the second thing is use your LinkedIn for real. Like, use your LinkedIn. Go and find people who are like first degree, second degree, etc., close to you, who are somehow linked to that government agency. And then if you feel comfortable enough, contact them and just say, hey, introduce yourself. You're applying for this position, or you're looking for positions. Are they open? Are there any that are open? The other tip that I will give you is that as a DPH employee, I will typically hear about job positions that are opening either right before they're posted or the day of when they're posted. So if you can connect with somebody through LinkedIn, and and if they feel comfortable enough connecting with you, etc., they can start forwarding you things that start to pop up that haven't been posted or were just posted. So I would say definitely use your LinkedIn. I did that when I started applying, and that's how I found out about how long this process is, through the friend who created this, who was also hired at DPH at the time, and she pretty much just walked me through, like, this is how lengthy the process is, this is what it's going to take, like, please be patient, blah blah blah. So just make a friend. So make a friend at DPH through, and I used LinkedIn. And I would say that's those are my tips for now.
Excellent. So I think a takeaway from that is, in any big bureaucracy, it's really good to have a network.
Yeah,
Right?
for sure. For
and,
sure.
and that people find their ways of sort of navigating through these, creating their own worksheets and their own process and sharing information.
Excuse me. Yep.
So, Caitlin, I lost most of the chat when I got bumped off. So I'm going to hand it over to you to ask Chris questions from the chat that have come in.
Yeah, absolutely. Well, I think, Chris, what you just shared answers some of the themes of some questions coming in, which is really trying to make this process that feels very opaque more transparent. And one of the questions was really, how important is networking when applying to public health departments? And so I think you shared, obviously, your advice related to LinkedIn. Just curious if you have any other thoughts about networking, not only when applying to public health departments, but if you could speak to what that looks like now that you're in SFDPH. You shared a little bit earlier about how large the organization is. So what role does networking play in general in a local public health department?
Yeah, so much. I made it a part of my mission within my first 6 months to get to know everybody everywhere, whether if it's within DPH or outside of DPH. If you're not comfortable with that, I would say try to step out of your comfort zone. There's different ways to network. So, you can, if you're not the type of person who likes to go face to face, you could always do like the LinkedIn route and then do it through like a text version, right? Or like written communication. But I would say it is huge, the type of partnerships that we were able to create, whether if it's through the San Francisco Giants, whether if it's through or with Recreation and Parks, if it was with the Tenderloin, TNDC, like Tenderloin Neighborhood Coalition. Like there's just so many different like professional networks that you could be a part of, and that you could kind of expand your own. And I would say definitely try and do that. Either get business cards or like through that work, or get your own. And for the longest time, I wasn't happy. I mean, I'll be honest, I wasn't happy with the one that Cal gave me. I don't know if I'm being recorded, whatever. But I wasn't happy with the ones that Cal gave me. So, you can look around, you can shop around. In Berkeley there, and I'm not getting kickbacks for this, so I'm not name dropping because I'm getting kickbacks, but there's a place called Replica Printing, and I'm sure there's a bunch of other printing presses that were there, but they're the ones who gave me the best deal for my own like homemade business cards. And before I was even before I got hired through SFDPH, actually I have it in front of me. I literally just went to Adobe Spark, which you guys as Cal students get access to the premium version. Everybody should. And then you literally just design your own card. That's what I did. And then because I wasn't happy with the business cards that Cal had given me, I had just created my own, printed them, and then whenever I was out, like going to a conference or going to a presentation or whatever it was, I just brought a handful of these and just continued to network, so that then you can see who does work at DPH or who works at wherever you want to work at. And then when I got hired at DPH, same thing. I brought the business cards with me, and then I just went. You just do your circles, seeing if there's anybody else who's worked with the same population and who wants to do the same type of work as you, and then just connect.
Those are excellent tips. Thank you, Chris. I know we do get questions about business cards, and certainly even now, we know that the spirit of handing out business cards can come through on LinkedIn, but I hope that those are some helpful tips for folks. I'm hearing that in the chat, so thank you. There are a number of questions, and I'll do my best to ask them around tactical advice navigating the application. So we appreciate your offer to share that document, and we'll certainly circulate that, and we can be available. I'll just say to everyone in the chat as well to help be a partner in navigating some of this. A lot of this is really around, there's a whole language that exists in human resources, we know, and so navigating, you spoke a little bit about, examination, classification, how positions are tied to classifications, and you've become a bit more fluent in this process.
Yes.
One area of, I think often of anxiety is around the application process, or excuse me, the examination process. Could you talk a little bit more about that experience? You said it was 3 hours. How did that how did that look for you?
Yeah, it was, yeah, oh God, it was a range of, so what it is once you make it past the application process, and I'm not sure what the screening is like. Actually, why don't I start there and then I can get into the examination. So in terms of the application process, just also remember that I don't know who exactly is screening. I'm not a part of HR. I have no idea. But what I've been told during that time period when I was applying was that it depends on how automated the screening process is. And if it is very automated, what I've been told to do, and I'm not saying that everybody should do this, but I'm just saying I did this, and this is, it's just one person, but is to make sure that you use very, very specific keywords that are in the actual job listing that you saw when you clicked on it, right? And then to be able to make sure that you use those within your resume, because, and or the application when you're submitting in, like your job title and the responsibilities, which typically most people would copy from the resume and put in, right? But you should also do a third step, or second step, which is like make sure that that language then matches up with the language that's in the job posting, and then you paste it in. And the reason why is because if it's an automated process, then that means they're looking for keywords only. And and with my job at Kaiser, just sidebarring for a second, with my job at Kaiser, their process is all automated. So if you don't use their keywords that they're doing, when I say automated, like a computer literally goes down and like scans for those words. So if you're not putting in certain keywords that they want in there, your application will get kicked out. So with that one, with HR at DPH, I'm not sure, I can't speak about what they do, but my idea is to at least use those keywords in there so that then you get past that first step, which is the application.
Well,
And
Chris,
then,
can I just add to that? Because when
yeah,
I was literally in my 20s, so 30 years ago, I remember getting a stack of resumes, and the hiring manager said, look through this stack and look for these words, and these are the people we're going to interview. So
right?
it
Yeah,
still happens, whether it's automated or not.
yeah,
Is
I
there your
agree.
person might be doing the same thing, skimming resumes, looking for keywords
Yeah,
to think, is this the person that we're going to
yeah,
bring in for the next step?
yes, yeah. So, so you've heard it from two people so far. So I don't, take that with a grain of salt. That's like a sample size of two, but still. So so then you've made it through the application process, right? So that's like the first step. And then after that, you get called in for an exam. And that exam, it was a written exam, and it had a list of questions. I can't even remember the question, but I just remember it was a range of questions. Like I was applying to be a public health nutritionist, and they were asking things that were like even some stuff that was like even a little bit, it wasn't a lot, but like even a little bit that was like clinical based. It's just really thinking like, wow, this is odd. But I think it's because the exam, everybody who's going in, because the classification is called nutritionist, everybody who's going in will be applying for any of the nutritionist positions. And because you have to create those job descriptions to be a huge bucket to cover a lot of different responsibilities. Some of those might cover like outpatient versus like public health versus blah blah blah. So it's an insane exam, but I just remember it being like, oh, so you have to know everything. What I could say about the health educator, because I took both exams, I did the nutrition and the health educator one, and I remember that it was just a lot of like that the health educator one was multiple choice, and that one would it was like taking public health 101 all over again. It was like there was some questions on theory, there's some questions on like I don't know, like which theory is it that explains I could say like stage of change, something like that, I don't know, but it was something like that where they actually asked you on like, oh, what this example is reflective of what kind of theory or something. It was really interesting to just, it wasn't as practical as I thought it was going to be, but but again, just know that you're taking this exam with everybody else, and no one else knows what's on this exam either. So you kind of everybody just kind of does it, and you kind of just get ranked according to how well you do. And then depending on the department, they can choose to either, I, I think the general rule is you can interview the top 5 people. You're given percentile scores, and it's like the top 5%, the top 5th percentile, or you can choose to interview all of them. It just depends on your manager. So for my position as the nutritionist, she interviewed everybody, which I think it's a little, like, that's a lot, but they really wanted to cast their net wide. So I hope that was helpful.
Yeah, I don't know if you
Okay.
mentioned it, but there are some positions too that are temporary positions where you don't have to go through the process. So I just want to be sure people are aware of that. And
yes, that is
and
correct.
so when you're looking at the job descriptions, just know that those temporary positions, it's less arduous.
Yes, yeah, and that actually that segues well into some of the other questions. I was going to make just one more comment on applicant tracking systems, that we do know that they are widespread in their use, including with SF City and County. Although that, and even Kaiser, as you mentioned, so many different organizations use ATS systems. But that doesn't necessarily mean that they are the most modern. So some of these are still very literal as far as looking for that keyword match. So that actually was one of the questions asked in the chat, as well as, to what extent there are algorithms. So making sure to be smart and tailored in your applications. Another one of the questions I did get at the timeline, right, which I know is a bit of a shock sometimes hearing. I appreciate you being honest and transparent about how your process looked, Chris. Understanding, what might some other pathways be? So for example, Ruthann mentioned temporary appointments. We know, contract appointments. Also get just understanding what falls within the purview of, the SF Department of Public Health. There was a question about, does Zuckerberg fall within that? My impression is yes. Does SF Health Plan? Actually, they do their own recruitment. It's much faster from what I know. But could you speak to just your understanding of other potential pathways from your experience working there, meeting colleagues who've maybe had different experiences of getting their foot in the door?
Yeah, sure. So so as you said, temporary positions. Yes, that's an easier, faster way to get through HR. You also have to keep in mind that with temporary positions, you don't get all of the benefits that a permanent position would get. And what those are, I'm not sure. I think it's retirement, but don't quote me. I'm not sure. So just keep that in mind, that there are temporary positions. Now, the problem is, like, that's a little bit more of an HR question, because if you start off as a temp, and then if they eventually turn that position into a permanent position, you would have to check with HR. But my guess is, if you do not automatically get the permanent position, though, you have to take the exam, you have to interview, and then you have to, rank, and then you'd have to get it right. So it'd be all those steps, and then hopefully you would get offered the position, even though you were working that position as a temp before. So just keep that in mind, that it's again, it's a very bureaucratic system, right? Like, this is how government works sometimes. The other ways that I've heard of people maybe not being able to bypass any of the government onboarding processes, because the stuff that I told you, that is standard. If you want to be a permanent worker, like, there's no bypassing any of that stuff. But if you want to get your foot in the door, you could be a temp. The second one is you could be an intern. So we currently are recruiting interns every quarter, every 3 or 4 months roughly. And so, and that doesn't mean that you'll actually, from an intern, you'll turn into like a permanent position, but it's more like you're getting yourself into the system, and then you can start networking. And then with those networks, you can do what I just mentioned, which is you would build these relationships, you'd see which department or division or unit you want to get into, and then build that connection. And then once they hear of a job opening, you can just make sure that you keep in touch with them as they forward it to you. But you know, in terms of like actually bypassing that process, you can't. You know, not as a permanent position, you can't. At least that I've heard of.
Yeah, I think what I'm hearing from you is just reinforcing what you shared earlier, which is the importance of networking as well, right? It's kind of trying to keep track of how does all of this fit together and learning about opportunities. And we also know sometimes there are short time frames for when applications are accepted. And so really, I just want to address, there were lots of kind of very specific and technical questions in the chat. So if you felt your question hasn't been answered, feel free to follow up with our office. But what I am hearing from you, Chris, is that you know, there are certain processes in place that need to be navigated. And so I know oftentimes HR and the specific name of the person managing the recruitment is always posted, I know, on the announcement. So don't hesitate to reach out to those folks. Don't hesitate to make friends in the department through LinkedIn or otherwise. And so really appreciate all of your application suggestions. I am going to pivot us a little bit because there were some other subjects that were asked about as well. And one of them, please. Yeah.
Just that around the Zuckerberg SF General, some of those positions are also posted through UCSF.
UCSF, yes, good point. Absolutely.
Yes.
Yeah.
Can I also mention one thing before we move on from jobs?
Yeah.
Caitlin, just really quickly. So when you guys get the sheet, also know that once you find the classification that you want, there is a button there that says, if you want to get an email reminder when this classification opens up, it'll email you that there's a new posting for this job or a new exam for this job, etc. So that then you'll always be up to date with when the newest opening is.
That's great advice, and I think speaks to, make your life easier by setting up systems that will work for you. So I appreciate you mentioning that. And I know there were some questions about what first step should I take? So really for folks to look into the classification sounds like the best first step in setting up an alert. So one of the other questions is really around, professional development, professional growth. How do you see opportunities for professional development or professional growth at SFDPH?
Oh, that's a great question.
Do you feel like there are opportunities for that for you?
Yeah, I do. I think, and I think it depends on what exactly you're looking for in terms of professional development. For me, anybody can vouch for this. I'm like more on the nerdy side, right? So I like I said earlier, like I took more stats classes, right? And so what the thing that I kind of missed when I pivoted into SFDPH was that it's very practice, it's very applied, it's a lot of community, it's a lot of project-based management. The only thing is I would have liked a little bit more stats, right? Like, and I get that because I'm a public health nutritionist. I'm not an epi person, I'm not a stats person. So what was great was that there was a huge email blast that was sent out to everybody who, and this is everybody, like including nutritionists, that said, they're doing the medical officer for DPH, who's pretty high up there, decided that they're going to do a book club, and it's on stats, like it's on like causal inference and all of these like crazy things, right? That makes your brain kind of like go mush. But it was great to kind of like be able to use that as one of my professional developments. And my department, well, my program, I would say, is very supportive of that. So if there's if I really wanted to go to this and I could, give a justification for why I thought that this might be a good idea to be able to continue to do this because it would help maintain my skills and I can offer this to our program, blah, blah, blah. I was able to go to these book club sessions where you would read a chapter on a stats topic, nerdy, and then we would discuss it for like an hour, and we would talk about counterfactuals and hypotheses and yada, yada, yada. But I thought like that was really great that at least my program was very supportive of that. I think if you're looking for they do a lot of brown bag meetings, and these are things that are done through different divisions or units within DPH. So one of them is the Black African American Health Initiative meeting. It's a brown bag meeting. So if you want to learn more about racial inequities, and specifically when it deals with the Black African American community, you have a brown bag session you can go there for. They did another one called the T10 series, which is looking at stereotypes and I would say like stereotypes and kind of discrimination, either within within the work that we do within DPH, et cetera, for Asian Americans. So I think that there's opportunities there. You'll get the email blast as we go, and if you really feel strongly that there's a gap, depending on who your manager is, you could propose initiating one of those. And they come from such a strong equity lens at the moment that they would be very open to that. Thank you.
Thank you, Chris. And I know we're
Sure.
coming up on the hour, and there have been so many wonderful questions. I think a final question to end with is, given your experience thus far at DPH, where might you see yourself going in the next 5 to 10 years? I know, classic interview question.
Right.
And really knowing what you know about your field as well. If you weren't working at DPH in some other parallel universe, where are some other places you might be working instead? What are some other places you've learned about even through your work there?
Yeah, that's a really great question. I did not only apply to government jobs. So it was interesting how life and the universe kind of made this all happen, because I had applied for government jobs. I had applied with the DrPH. It's a degree that works at the intersection of research and practice, right? So you do your research stuff, but you also come in with a lot of your practice work. And so I actually applied for both. I applied for both practice and research jobs. So I applied for postdoctoral research jobs. I applied for the government jobs. I applied for ones that were kind of like in between. There was a bunch of different ones. And what was funny was that I kind of just threw everything out into the mix, which is something that some of you can do, right? And then figured out like which one kind of bit back first. And it's odd because I ended up getting SFDPH first. I remember talking to Caitlin about this. Caitlin is a master, by the way, at being able to answer questions that I'm not brown nosing, but like answer questions. And she also helped me negotiate my salary. So I'm just saying. Anyway, so the point of this is that like I had applied for so many different jobs, and Caitlin knew about this because I was updating her. And it so happened that DPH got back to me first, and I interviewed with them, and they made the first offer. When 2 weeks later, I was actually offered the postdoc position, and then I was offered the other position that I was looking at. So it really just depends on timing, I would say. So where would I be in 5 or 10 years? I don't know. I think I like DPH. I could see myself being there. I would say definitely for the next 5 years-ish. I have an amazing, and it also depends on your work culture. I have an amazing boss, and I also have an amazing like boss. So, and she sets the tone for everybody else in that division. So because she is so strong in that, it's really hard. Like it's hard not to have a good time when you're there, right? Like, so yeah, I would say in 5 years, probably still be at DPH. I think it depends on how satisfied I am with that job, and then whether or not if I would either move around DPH, which is also another possibility. And people tend to do that a lot in DPH. Once you're in, it's easier for you to jump around the system. And that's it.
Thanks, Chris. No, it's so helpful. I wanna let Rukin chime in with any last thoughts as well, but I think I speak for everyone when I say this has been really valuable advice, both on the tactical front as well as hearing about the importance of workplace culture and these other factors. And so sometimes it is timing too. There can be some randomness in that. I remember when you found yourself with several job offers all at once.
And I was like, wait, what happened? This is
right.
like, and it was like 7 months later. I was like, wait, what?
No, it all, but you were planting a lot of seeds. And I think that's what those results really spoke to. So appreciate you sharing about the process to get where you are today. Reiterate, just all of our gratitude. I'm seeing it in the chat as well for your time. We hope that you'll be a friend in SFDPH. Ruthann and I, to everyone on the call, we want to continue to be a resource to all of you, whether it is figuring out the details of the application process to salary negotiation, everything in between. So just, thank you again. And Ruthann, I'll turn it over to you to close us out.
I'm just going to say thank you again. These sessions are being recorded if you weren't at the beginning when it always reminds us. So, we will definitely get that sheet out to you that Chris is so generously offered to send to us. And again, Chris, thanks for being an awesome alum, and everyone be safe and healthy. And I know it's all stress and uncertainty, but be sure to take care of yourself.
Yeah, stay healthy, everyone. Thank you. I hope it was helpful. I'm doing my best to try and be as concise and as efficient as I can to give you tips and not like, just kind of like jab too much. But anyway, so I hope that was helpful. Thank you for letting me.
Lots of thank yous, and you're the best.
Yes,
Chris.
lots of thank yous. Very helpful and insightful, Chris. Thank you.
Yay. I'm glad it's helpful. All right.